As professionals, we work together to provide care to the people of Eastern Cheshire in an integrated way.
I'm Bernadette Bailey. I work as a Service Delivery Manager for Eastern Cheshire Clinical Commissioning Group and have responsibility for commissioning a range of health services across Eastern Cheshire. We've identified that due to our ageing population and the numbers of problems that people have in later life, that we need to commission services differently. The specific information around this is that the majority of people over 75 live with 3 or more health conditions, and only 5% of patients who have dementia only have dementia. The way that we currently care for people is that we tend to treat their conditions separately, rather than looking at their needs in a holistic way from their point of view. Eastern Cheshire Clinical Commissioning Group has been working with Cheshire East Council to commission a different approach to meeting the needs of people with long-term conditions. We wish to move from a currently fairly acute hospital-focused approach to care that reacts once people have problems, to a more proactive approach that is more community-focused.
I'm one of the GPs and I attend Caring Together neighbourhood team meeting that we hold here in Knutsford, and this is the Caring Together neighbourhood team meeting room. We have it every 2 weeks, and around the table we have professionals from all different organisations, which is a new way of working which we haven't really done before. As a general rule, we have around the table a GP from the three different practices in Knutsford. We have community matrons, district nurses, as well as colleagues in social services, community mental health teams, and other allied health professionals like occupational therapists, community physiotherapists, community pharmacists. What we do at the meetings is discuss service users, patients, and we do it in an integrated way. We agree between all different organisations and the people around, the professionals around the table, what would be the most effective way of looking after these vulnerable elderly patients and how to maintain their independence at home. And that includes choosing one person who will coordinate the care in an integrated way, and that person could be from any of the organisations. And again, this is a different way of working than what we've done before.
I joined the intermediate care team in a nurse role from working on the hospital wards. One of the biggest differences I found was that the person was being looked after, our team looked after that person as a whole person, not just concentrating on their illness and looking after their social needs, their home needs, and also their physical and mental needs as well within the team. When I joined the intermediate care team, I had been working very much on my own, and to actually join our team, I think you need to be a very good communicator and be aware that you need to pass on information to your colleagues. And the challenge sometimes is actually passing on that information, making sure that you've either passed it on verbally, or that we actually write it down, or that we highlight it for the correct person. From my previous experiences, I might have been the sole person actually delivering the care to that person and making decisions. Whereas within our integrated team, we have key workers assigned to the clients, to the patients, who would formulate the care and liaise with other members of the team to actually action the care that we give. So when a person's taken onto our scheme, we would highlight who is the best person to be a key worker, to actually lead on that patient's care. The aim really is to get the person with the correct key worker to drive the patient's care forward. We would get together in the morning and discuss who was going to see which of the clients, so there was no overlap. That's when we would discuss if there's any concerns with the patients that we're going to see for that particular day.
My husband and I have always been very well, but just recently we've had a spell where we've not been too well. I had a chest infection and my husband he fell, hurt his back and was in a great big pain. So a physio and a nurse came to see us at home, and we had a discussion with them, and they thought it would be a good idea if we went into respite care. So this is what we decided to do, and we went into one of the residential homes. I started to get better and started to help looking after my husband. Unfortunately, he was sleeping more, and also his memory was getting worse. And we had a key worker who would notice this. This key worker was very, very useful for us because it meant that we had somebody to talk to and she could explain things to us. And it was decided that he should have a mental health assessment and a review. This took place, and again she explained everything to us. Eventually it was decided that we might be able to go home if we had some care from the intermediate care team, and this was arranged.
I personally find there is a great advantage in sharing information between each other. If I go and see one of our patients and I have a problem or a concern about that person, I know I can go and have a face-to-face conversation with one of my colleagues who might be more used to that particular problem. I would just like to say that I actually really enjoy working in such a team as ours, knowing that there's always somebody to rack my brains with if I get stuck on something, knowing that we're all there actually for the patient, for the person that we're looking after.
There was 3 parts of the intermediate team who helped us. One was the rehab team, and they helped sort out our mobility needs. A community team who gave us support at home and gave us the care that we would need, and a medical team which treated our illnesses. This was all put in place, and when this was all ready, again we had the key worker who explained to us exactly what was going to happen, and we were able to go home. We couldn't have done this without the intermediate care team. They were absolutely marvellous, giving us all this care and support, and we would then be able to live independently for the future.
The examples you've seen on this video demonstrate a different way of working than what you may be used to in the past. I think with the growing and ageing population in Eastern Cheshire, we have no alternative but to embrace this different way of working together. The Caring Together Leadership and Workforce Workstream are committed to enabling this to happen in Eastern Cheshire.